Let's discuss balancing distal and local points. Distal points, part 2. As mentioned above, distal points are not only those on the channel involved. For example, in an eye problem deriving from the bladder channel, distal points would be those on the other extremity of the bladder channel on the foot. However, Li4 would also be an effective distal point because it is a point that is used as a distal point for all problems of the face. In particular, when distal points are selected, the close connection between the channels of the same polarity, for example, greater yang, the small intestine and bladder, lesser yang, the triple burner and gallbladder, bright yang, the large intestine and stomach, greater yin, the lung and spleen, lesser yin, heart and kidneys, and terminal yin, pericardium and liver would be borne in mind. These channel pairs unite corresponding arm and leg channels of the same polarity and same potential. This pairing means that distal points of paired channels may affect the same areas. For example, in ear problems stemming from the triple burner channel, the applicable distal points are points in this channel below the elbow, especially TB5 and TB2. Okay. However, due to the close connection between the triple burner and gallbladder channel within the lesser yang pairing, points on the gallbladder channel below the knee may also be selected as distal points for the ear problem. Example GB43. Thus, the distal points of paired channel are almost interchangeable. For example, TB2 and GB43 for ear problems, Li4 and stomach 44 for gum problems. However, it is interesting to note that such connection and interchangeability is closer for the yang than it is for the yin channels. The reason for this is that while the yang channel connect directly and superficially on the head or face, the yin channel connect on the chest or abdomen, but only at a deep level. Thus, we can look upon the yang channel, for example, greater yang of small intestine and bladder, almost as a single channel joined directly and superficially on the face. So we could look upon the large intestine and stomach channel, for example, as one channel from this point of view. The same applies to triple burner, gallbladder, and small intestine bladder. So we have here the illustration of the cycle of chi circulation in the 12 channels. And here, the chi circulation between the head and the chest. So as illustrated from the stomach, it goes down to the spleen, then back to the lung, and goes to the large intestine and back to the stomach. Thus, in the case of the yang channel, we have a choice of distal points to use, either on the hands or feet, as the points are quite interchangeable. When there is such a choice, we should bear in mind that the distal points of the legs have a stronger effect than those of the arm. For example, for stomach heat affecting the gums, stomach 44 has a stronger effect than Li4. For the yin channel, it is somewhat different. The yin channel all end or start in the chest or abdominal cavity, and they do merge into one another, but only internally, whereas the yang channel merge into each other directly and superficially on the face. Thus, in the case of yin channels, we do not have the same free choice of distal points as for the yang channels. For example, PC6 and liver 3 have some common properties insofar as they both move liver chi, but besides that, they have quite different actions, and there is not really a question of choice between them as a distal point. Finally, with regards to the local area affected by distal points, there is an important general principle that states that the farther the farther away a distal point is from a given area, the more it will influence it. For example, if we take a long channel such as the stomach channel, stomach 45 and stomach 44 will affect the other end of the channel, that is the eye and forehead. Distal points slightly farther up, such as stomach 41, will affect a lower section of the other end of the channel, that is the throat, as illustrated this principle in figure 70.8. So we have here the areas affected by distal points. From the lower leg, it can influence the affected area on the chest, neck, and head. Distal and local points. Local points are those in the head and trunk. Distal points are the points on the arms and legs below the elbow and knees. The arm and leg points of channel of the same polarity and potential. Example, greater yang, greater yin, are almost interchangeable. For example, liver 4 and stomach 44. Leg distal points are stronger than the arm distal points. A distal point may be on a channel different to the channel where the local problem lies. For example, liver Li4 for the bladder channel eye problems. Thank you for your attention.